Sabatia Mudavadi. Asante. Basi mti wa kwanza hapo ni wa waziri wetu. Anachota mchanga, anaweka kwenye mti huo. Tunafaa kuwa tunamshangilia Prime Cabinet Secretary wetu kwa makofi anapofanya kazi safi sana. Huu mti najua pia utanawiri, mheshimiwa. Wapi makofi kwa wageni wetu? Makofi na vigelegele tafadhali.
And grateful to God for those who had the vision to establish this hospital. This hospital is playing a very important role in the area of treatment of eye ailments. It is the only hospital in our region, and I would say it's one of the few special hospitals in the country that are giving specialized treatment. So I want to thank the board through the chair, my good friend Lulu. Thank you for the good job. I also want to thank the staff for the good job you are doing. Further, I want to thank our development partners who have stood with us, who have worked with us to bring this hospital to where it is. We want to say we are happy and we want to continue working together. But I want also to echo what the chair has said. Our development partners are helping us. We can also come out ourselves. I know.
Indeed, it gives me great pleasure to join you, Prime Cabinet Secretary, and join the hospital on this auspicious occasion of the launch of their pediatric unit together with the training center. And having looked at it, this is a center that is going to serve not just the people of Vihiga, but far and wide in the country, as it forms a major cornerstone of the specialist eye hospitals that we have in this country. Prime Cabinet Secretary, there is a rapid assessment that is ongoing on avoidable blindness. And currently, the statistics as at December 2022 indicate that 4 out of 1,000 people in Vihiga County are at risk of blindness, yet these are treatable conditions. PCS, this translates to about 2,500 blind persons in Vihiga. In that estimation, we can project up to 200,000 Kenyans that are at risk. And therefore, I'm so happy to stand here and support this facility in the endeavors they're putting in to HIF fund. However, I am happy to report PCS, as at this morning, I received a call from Treasury that funds have now been disbursed to NHIF. And now the facilities, which I'm sure this is one of them, once your claims are verified, you are going to receive your payment. I want to call upon all other healthcare providers that they resume services, those that had stopped, as we process claims and ensure that we make payment. But again, I want to assure you that I am not going to oversee graft. And PCS, this falls in line with what we are doing at the moment at the Ministry of Health. On several occasions, I have told Kenyans that as a ministry, we are now not focusing on curative services only, but we want to give emphasis to preventive and promotive healthcare. And to achieve that, we are going to launch over 100,000 community health promoters. And in my discussion with the governor early in the morning, he told me that in Vihiga, he has over 1,500 community health promoters. Tupigie Governor makofi. And I want to assure you, Governor, that we are going to work with you. In a month's time, I'm going to bring gadgets like this one I'm holding for your community health promoters.
Ladies and gentlemen, Mirembe, hamjambo. My first question to you is this. Susan anatosha ama hatoshi? Asante sana. She has spoken so well. She has communicated effectively. Madam, the NHIF, you touched on it. Kaza kabisa. Kenyans really want to benefit from that universal healthcare program, and the support of an efficient NHIF is absolutely critical. I've taken very positively, and we have taken positively, your message about corruption, ufisadi, and the way you quickly worked with the president to deal with the KEMSA problem, extend that whip to other institutions where people are misusing public resources, especially in the delivery. Watu wa Sabatia Eye Hospital. It is now about 27 years since we started this program. The success of this institution is vested in others who are not with us here today. They were here, they have gone. There are those who are running it today, and there are those who are going to continue with the process. It is important that as we mark 27 years, 27 of this eye hospital, we give a round of applause to the management team and the board because they have made us proud. They have engaged with the stakeholders very effectively, CBM, Lions, the Rotarians, and our other players, the University of JUCAT, the ministry. They have engaged very positively. And in the process, this hospital has seen better things. It has some of the state-of-art equipment. And as I was walking, I was just asking, and how much would this one cost? And they say, this one, just a piece of equipment. This one is worth 5 million. This one is 7 million. And there are others that are worth more. Inside here. This hospital, as you know, you can actually have your eye operation through laser. Through laser. In the middle of this county, you can actually have your eye dealt with through laser. That's not a joke. It's a very, very serious achievement. And we must consolidate and build on it. Looking at my notes, countries like Rwanda, Burundi, Cote d'Ivoire, Botswana, South Sudan, have benefited from this institution, and cumulatively over 30 specialists have been trained from those countries through this institution. So you are also diplomats. Because through that outreach, you are now reaching other nations in this very specialized area. So we need to really harness institutions of excellence, institutions that provide unique services in our various sectors, and here specifically in health. They are now they've dedicated the children's wing. Then you have the grown-ups. Then you have the facilities that go here. So let us always embrace good management. And one of the things that I also say is strong with this institution is that it has embraced working with people from all over the country. Mr. Chairman and your team, you have done us proud. You have not been inward looking na kusema kwamba hii ni ile alafu tunaweka ukabila ndani, and you don't want to work with everybody. Everybody works here. That is how national institutions should be. That is how we can grow our country, by bringing everybody and working together.
Waziri wa afya wa Kenya Susan Nakhumicha sasa anafungua rasmi bamba hili la kituo hiki. Makofi, shangwe na vigelegele.
Or then there is a sweet song. Don't worry. But
No, I think this is
everything you are doing, you see it on the screen. Yeah. It's good. So you can do two. Florence here is in charge of the theater.
Honorable PCS Health Ophthalmic Theatre. This is where we perform our pediatric surgery.
It's much better. Not that it is, the other one is bad, but it's much better than removing a cataract for somebody who's 60 or 70. Some of the awards, children are admitted with their mothers. Oh, is this one that they gave the flowers?
And even the patient's gown is good for the kids.
Yeah,
it's very nice.
Yes,
they look at it and they feel happy.
So Jen, this is your award.
10. Yeah.
10.
Good. Thank you. So it means we can
Yes.
improvement. I see.
There is still.
This one was alikuwa na shida gani?
Alizaliwa na ya white blood ya macho.
Pediatric surgery there, a few, but to a particular amount.
Umetibiwa? Thank you.
Karibu tufungulie rasmi.
Okay.
Haya basi.
Na mimi ni
Tumshangilie kwa makofi mkuu wa mawaziri anapofungua kituo hiki cha mafunzo.
Okay.